Hi, everybody. Good morning. We'll wait a few more minutes if we have any more participants joining us today. So we're ready to start, and we'll just give it a few more minutes. So it's time for you to make yourself another cup of coffee or whatever you need. Okay, so I think we're ready to start here, and most of us are already here. So good morning, and we're very happy to join you. As always, quick review on the platform. So you have on the right-hand side, you have the panel that enables you to ask questions, raise hands. You can also download the handouts, which are the QRGs for the Evolve, the 3 applicators of the Evolve, and Evoke, the presentation in a PDF format that I'll be using today. And also this time I have uploaded some really good webinars performed by Dr. Erez Dayan in the USA. I've uploaded them onto that platform, so you can watch them online. It's a link to YouTube, and it's highly recommended to watch. So you're very, very welcome to use that. Yeah, so let's start with our presentation for today. So I'm assuming everybody hears me, right? Because nobody says that they don't, so we can go on. Okay, so this is just a, I don't know how it will show on your through the web broadcast, but this is quick. Okay, so this is that was a really, really quick overview, and the reason why I do choose to show it even during a webinar is because I do actually think that it summarizes everything. So maybe after reviewing the software, the platforms, we can actually go back to it and say, oh wow, that does really give us the big picture. So we're talking about the Evolve is a hands-free, non-invasive thermal body and skin contouring. The platform supports multiple technologies, specifically 3 different technologies. It saves your time as the operator. It allows increased treatment time to improve the results, and does not depend on your operator's expertise, and therefore provides possibility for reproducible treatment results. So, and most of all, addresses multiple problems of body contouring, and we'll get there in a minute. So these are the 3. We're kind of diving into it. Okay, so we're starting largely, and then we'll talk about each of the technologies separately. We do have a busy day today because I want to cover the Evolve and the Evoke, and these are 2 different platforms. But I am assuming if I'm covering the Evolve properly, the Evoke would be much shorter. And also, I am relying on the fact that we've been through the Forma and Plus applicators last week, and also the body effects and mini effects applicators that are basically the older brother. So I might not be getting into the very specifics of the applicators. So if you have questions, you're very welcome to contact me immediately or later on. Alternatively, you can also review. You have the recording of last week's webinar for Forma and Plus and body effects, mini effects. You have the recording sent to you, and it's possible to watch it and get updated on the previous technology in order to understand this one better. So back to the Evolve, we're talking about 3 different hands-free technologies: Tight, which uses RF only; the Trim, which uses RF and vacuum; and the Tone that uses EMS, electrical muscle stimulation. And mostly, all 3 technologies can be used on different areas of the body. Okay, so you can actually provide solutions for all body areas, which is really cool. A little bit about the mechanism of action, and this is generally, it's very largely speaking. With regards to each technology, we'll dig in further on. So a little bit about skin remodeling, what happens at different ages, and up until the age of 30, we're talking about increased or higher speed of buildup of collagen, elastin fibers, and hyaluronic acid. Generally speaking, these are the youthful years, which actually, well, as we all know, we're looking younger and more, and this is where we want to kind of sit between 30 to 35 age of year. Yeah, between 30 to 35 years, there's kind of a plateau, so we're not building up anymore. Skin is not getting any younger, but is not getting any older either. And from 35 down, it's actually downhill. Okay, so the rate of remodeling is decreasing, the rate of production of collagen and elastin is decreasing, and the rate of destruction is faster. Okay, so this all together results in an older looking appearance. Well, the A.C.E technology, I thought I kind of hid that slide, but generally speaking, it talks about InMode's unique technology to be able to control the temperature. Okay, so I'm not going to talk about it in the sense of A.C.E, acquire, control, and extend, but I will explain what does it mean, because it does apply for the tight applicator, for the trim applicator, and also for the Evoke, two different applicators for the facial hands-free system. Okay, so the idea is that, as exactly like in the Forma and in the body effects applicators that we already know and love, we have a temperature of a very, very unique and effective temperature control mechanism. So there is a temperature sensor embedded in the applicator that gives you an online feedback on the temperature, on the skin temperature, on the epidermal temperature, that enables you to work at the maximum temperature to be most effective without actually harming the skin. So once we're getting to that cutoff temperature that we're defining, we can then prolong that treatment time and stay there for longer, for as much as we want actually, because at that moment that the system reads that cutoff temperature has been achieved, it kind of stops the RF for that time being and then generates it back, okay, when temperature drops below it. And this is the idea here. Now, with regards to the Evolve, because we're talking about hands-free applicator, then we have to have something that actually kind of gives the patient some control on the treatment in order to prevent any side effects. Okay, so this is why we have the call button, or whatever you want to call it. But the idea is you give that button to the patient with every treatment, okay, and patient holds it, and as soon as the patients are feeling something that they should not be feeling, so it's too hot, something feels off, they can just press it and it will automatically pause the system. It would not stop it, it would not it would not turn off the system, but it would pause the treatment and will enable you as the operator to make the necessary adjustments, whether on the screen or on the patient's body, and continue the treatment from that point on. So so yes, safety. When talking about hands-free devices, safety is one of the most important things that we can actually think about, because we might not be as tuned to our patient if we're not with the hands on the patient. Okay, so so it is very, very important that we have all these safety measurements embedded in the systems. So first of all, we have the audible indicators sound, very similarly to what we've seen last week with the Forma and the body effects. Okay, so beeping sound at the rising temperature phase, 1 beep per second, 2 Celsius below the cutoff temperature, 2 beeps per second, and then at the cutoff temperature, 3 beeps per second, at which point the RF is being cut off. The call button that we've just discussed, the screen that enables you to visually monitor each applicator separately, and we'll see it later on. And also, you have to remember we're talking about RF, which is color-blind technology, and therefore can be applied to all skin types. I would take a moment and show you that video, and I'm really, really hoping that that would show good on your side. Let's see if we had any feedbacks on the short video before. So if it's actually not shown, where's the link to YouTube videos? Can't see it. It's on. Oh, okay, so the link to video to the YouTube videos should be on the. Oh, wow. It's no. It's not the handout. It's videos upload. So we'll check into it, and it's there. It should be there. Okay. Let me just. Can you check it? Can you log on in as somebody else? Thank you. Okay, so Judy's on it, and she's checking exactly how to get to that to these links. Okay, and we'll get there. And I see that you can see the videos. So I do want to show you that setting up of the system video, because you only have to do it once when the system first arrives into your clinic, into your account, and then it's set. But you have to do it right on the first time. Okay, so it is very, very important, and I will show you that video. So first you unscrew the screws on the back of it, and you want to use that metal lead here in order to be able to rest that plastic bar on it until you screw the screws back in these two holes. Okay. Now I know it might not be relevant for all, but for those of you who it is relevant for, it's super important that it's done right, and therefore I'm taking a moment here. Now you see the demonstration connecting the cables from 1 to 4, and it's very, very important that you're matching the numbers correctly. Personally, I recommend starting from the top, from the bottom up. Okay, so start with 4, 3, 2, and 1, just because it's easier. It's a little bit more comfortable doing it that way. So just a personal recommendation. Doesn't matter as long as you do it right. I also recommend pulling the connectors a little bit, just to make sure that they're properly connected. Okay, so you don't think that you're done with setting up the system, and then you're turning it around and you see something is not connected properly. So you have 8 cables to connect properly, and you better do it just once and right. Why is it stopped? Oh, sorry. Okay, so now now we're seeing connecting the cord. Okay, so electricity. And another thing that I might have missed or didn't see, we have to connect the call button. Okay, without call button being connected, the system would not operate. Connectors here on that side of the systems are similar to what you already know from our older systems or other systems. Okay, so same as the Fractura and the Forma connectors, and the call button is the same connector as the foot switch. Now this phase is really, really important because you have to flatten the cables, all 8 cables, including the 9th cable of the call button. You're going to have to flatten it into that canal here. Okay, so she's just now connecting the call button. It's super, super important that it's done. Personally, I do it before, again, because I think it's just more comfortable. Whatever, as long as it's connected. And I remind you, it only has to be set up once. So take a minute, do it right, and then you're good to go. Okay, in order to do now, what was skipped here, and this is a crucial phase. Okay, so I'm going to stop a little bit. What was skipped here is that you actually have to flatten all cables in that canal a little bit in order to be able to magnet that lead back on. Okay, and in order to do that, you sometimes need to pull the cables from the front side of the system to enable that properly. and that's another magnet, and you're ready to go. There's a little knob that comes magnetic. Yeah, that's the one, and enables you just to rest the call button. Now you're ready. We're ready to go, and I think that was what I wanted to show on that part. Okay. So again, just when applying the unit, make sure that the cables, that the numbers are correlating with the numbers on the system, because if you're not doing it first time around properly, then you will not have the correct feedback from the system when working. Okay, so you do it once and you do it right. Okay, with regards to the other side of the connectors, and this is true for all of the applicators, so the tight, the trim, and the tone. We're talking about push-pull connectors. Okay, so this is slightly different than what we know so far. I will demonstrate how to use them on the hands-on part. Generally speaking, we're not twisting or anything like that the cables that would completely ruin them. We're just pushing and pulling very, very slightly. It's much easier than you might think. We're matching the red dot on the cable to the red dot on the applicator, and this is true for all different applicators, and we're good to go. Okay. Contraindications, as always, I'm not going to read through. Please read them. Make sure your patient is not suffering any of the contraindication. Make sure that they that the operators, that the doctors and operators are aware of the contraindications. Make sure that the patient is signing a consent form, an informed consent form, confirming that they're not suffering any of them, and then you're good to go. Okay. So let's talk about the first applicator, which is the tight. So the tight has 8 units of the applicators. Okay, the applicators are generally mimicking or giving the same effect that we delivered with the plus applicator. So we're talking about volumetric heating of the skin and the subdermal layer, or mainly the dermal layer, and yeah. So we're talking about we kind of talked about these things already. Okay, so we have the temperature sensor and the impedance contact control to exactly the same as we've talked about last week with the Forma and the plus applicator. So whenever there's a bad contact, you'll hear the sound, and it'll also stop the treatment for that area, for that unit. Sorry. Because we're talking about technology that is basically the same as Forma in the past, we're talking about epidermal and dermal heating to the extent that would actually induce fibroblasts to create more collagen and more elastin, and that would eventually result in thicker dermis and less wrinkly appearance. Okay, so this is how it looks like. We've talked about it, we've seen that, and again, so we're talking about non-ablative dermal subdermal heating through bipolar radiofrequency. I kind of skipped that part today because we've covered it with the Proctora and Morpheus. We've covered it with Forma and Body Effects. So I'm under the assumption that you guys are already aware of what is RF, and if you're not, then you're welcome to view the former webinars. Okay, and the idea is that we can maintain the optimal temperature in the dermis, and this is due to that unique technology that the InMode offers that enables monitoring the skin temperature and prolonging the treatment time at that effective temperature without actually putting your patient at risk. Okay, so a little bit about what we have to do before the treatment. So again, as always, and I kind of read that once and it shows again and again for all different applicators, but it's very practical side. So I'm gonna go through it now, and then for the trim and the tone, and even for the evoke, I'm going to kind of skip it because I think I trust you guys to be smart users. Okay, so any irritant agents that are normally topically used should be stopped 2-3 days before the treatment. Always wear sunscreen. That's something that is generally recommended. Yeah, ensure that the patient has clean skin. So normally I ask my patients to arrive with clean skin, so no lotions or makeup or anything like that, just because it's better coupling and less ruining, less damaging for my applicators as well. Okay, and we're gonna have to clean again, as I said, I personally prefer the cleaning the applicator immediately after the treatment rather than immediately before the treatment. So this is something that you have to choose for your clinic, what you do. Yeah, and also very, very important, standardized photographs before and afters. It's very, very important. Patients tend to forget what they came in for, and you help them remember, and you help them being a more content patient. So yeah. Okay, so first of all, and this is, again, this is super important for all of the different applicators, okay? Let's just see timings, okay. So this is super important for all applicators, for the tight, for the trim, and for the tone, and also for the Evoke, for the facial hands-free system. Always test the patient call button prior to the treatment, and this is up to you. I don't want the patient to first test it. I want you to test it, okay? I want you to make sure, as the operator, make sure that the call button is working before you're actually handing it into the patient hand, because this is their ticket out if something goes wrong. Not that something should go wrong, yeah, but this is their safe ground. So yeah. Let's talk about belts. Selecting appropriate belt size. So we have a set of belts, and I will take a moment here, and it actually doesn't show on the presentation the entire belting system that we have here, but there's a set of belts that comes separately, and the belts are not single use, but aimed to use per patient, sorry. They're not aimed to be washed in a washing machine. I cannot promise that they will last washing machine on a regular basis. There's no other way to sanitize them or anything like that. And the set of belt comes with 3 different sizes of belts, okay? So it comes with the large belt. You can't really see it, I guess, here. So the large belt, it shows it's really, really long, and it has a light gray side and a darker gray side, okay? The medium size, that again has 2 sides, okay? 2 different shades of gray, not 50, just 2. And then the small one that is darker gray on both sides. So the darker gray for all of them is adhesive, okay? So for the smaller one, it is easier and I can make any adjustments. You can either work, oh, and it also comes with a buckle, okay? So, and this works that way. So you can either work with 2 different sizes of belt, whatever you need to adjust to the patient's size and to the treatment area and to your needs. But the question with regards to belts and how to clean them always comes up, and these are aimed per patient. So that's the only thing that is important to understand. And yes, with regards to the different sizes and possibilities, remember that the lighter gray side is not adhesive, so don't count on it. We're marking the treatment zone prior to the treatment on a standing patient, as we always do, to make sure that we're targeting the correct treatment area. And then we want to make sure that the patient is comfortable on the bed, okay? Because it's going to be a long treatment, especially because we can actually do other things during that, okay? So you can apply the units on your patient's body and then give a facial or whatever they need. Yeah, so that's that. Applying the units on the gel. So there are several means to do that, okay, or techniques to do that. You can either apply the conductive gel directly on the treatment area. You can apply the gel on the applicators, electrodes, or you can apply them a little bit of both. I find it easiest to make the adjustment, and I'll show it on the hands-on part, to make the adjustments on my patient, then apply the gel on the units and put it back on. So, but you can find your own method, whatever is comfortable for you, as long as we're maintaining good contact of the units and gel covering the electrodes to maintain to provide good coupling, you're good to go. And obviously after application of the units with the gel, make sure there's minimal movement in order to actually target the treatment zone that you wanted. Okay. Yeah, So make sure that the belt is not too loose, okay? Because if it will be loose, then it would kind of move around a little bit, and we don't want to do that. If you need to, you can adjust and secure the units with additional belts, like shown on the picture on the right here, okay? When working on relatively small and curved areas, mainly arms or like that, then distancing the units a little bit from one from another might enable you working in a safer manner. So you're just going to have to do that. Make sure that the idea is you're going to have to maintain good contact of all units that are applied to skin. Yeah, we talked about that, matching the red dot on the cable to the red dot on the unit. Do not twist it because you'll ruin it, and patient's already holding the call button at this point. Okay, and this is how it looks like. So let's talk about the treatment screen and the actual treatment. Okay, so first of all, I must say we should not be leaving the room as soon as we've pressed play. Okay, so we started the treatment and left room. That's wrong. We want to stay there next to our patient for at least a few minutes and let the temperature rise in a safe manner. See that the treatment is maintained properly and performed properly by the system, because it is a system at the end of the day, and we're smarter than it. So it's our responsibility to make sure that it works properly. So we're allowing the system, we're allowing all working units to reach to that temperature, and then we can start considering leaving the room. Even then, you have to make sure that the patient is holding the call button and have a way to communicate with you. If they don't have a way to communicate with you, then you're left in the room. You don't have to actually work on your patient, but you're left in the room. Yeah, so if one of the and this is really important, if one of the applicators significantly delays with reaching the temperature, it is a warning. It's a warning sign for you to check if there's good enough coupling or not. Okay, so normally at this point, what I want to do is I want to tighten the belt a little bit, or shift the specific unit a little bit, and then continue the treatment. Okay, if you've done all necessary adjustment and that unit is still way behind, then you can press it on, just touch the screen and disable it by touching it. You don't have to disconnect it or anything like that. You don't have to make take any extreme measures. Just a quick touch on the screen, and that would disable the unit. So just before actually talking about how it works, I want to explain generally how the system works. Okay, so this is true for the tight, but it will also be true for the trim applicator and also for the Evolve. Okay, so we understand that perfectly well, and then we can go through everything else faster. So the system actually works as two different systems theoretically. Okay, so we have one system that is covered by the first RF card, and then we have a second system theoretically, yeah, that is covered by the second RF card. Each of them is working, they're working parallelly, okay? So when number one is working, number two is working, assuming that we have units that are connected to these cables. And one, as I said, is controlling cables 1 to 4. 2 is controlling cables 5 to 8. And as I said, they're working parallelly. So when cable 1 or unit 1 is working, unit 5, if connected, will be working as well. Same goes for 2 and 6, 3 and 7, and 4 and 8. So they're working parallelly. How exactly do they work? So for the tight applicator, we're talking about a cycle, or a duty cycle of 8 seconds in total, okay? It's not to say that each unit is working for 8 seconds, but there is a cycle divides on those 4 units of 8 seconds. Each of the units is working, has an on time of 2 seconds, okay? So one will be on for 2 seconds, the rest will then be off. Immediately following 1, 2 will be on for 2 seconds, and number 1, 3, and 4 will be at off time, and so forth and so forth. And this is also true for the parallel RF card number 2. Okay, so when finally reaching 4, the current flows back to 1 and starting the cycle all over again. I'm hoping I made myself clear. In total, each applicator has 2 seconds off time and 6 seconds, 2 seconds on time and 6 seconds off time. That's in total, and that also enables and that really mimics once you apply the units on yourself, on your body, you kind of feel it. It really mimics the movement that we've done before with the plus applicator on the body, okay? Because you didn't constantly heat up a certain point, but you moved your applicator across the treatment area. So we're doing exactly the same. So this is a short video showing, and this is super important today because unlike normally that we have a real life patient, and we did get that comment on one of the webinars that it'll be better if we have a real life patient. I totally agree with you, but due to Corona outbreak restrictions, we're not allowed to provide real-time treatments on real life patients. So that's why we're using the help of Lisa. So especially today, this is important because it shows exactly how the temperature rising. And what I want you to see here is the color coding, okay? So it is actually a very quick video. You can see that each applicator has different temperature sensor. Each of the applicator can theoretically be at a complete different temperature and would still be working properly, okay? As I said before, if there is a massive delay with one of the applicators, me as the operator would want to go and check it. But generally speaking, this is a view that you may have. And for these applicators, for the colder ones, I would wanna make the adjustment and make sure that the temperature is rising properly. Okay, so yeah. Another thing to show here, I think, is the working. No, we're good. Okay. So again, this is the screen normally when working on a real life patient. Afterwards, I kind of show just that one, and this really gives a nice idea. And at this point, I also want to talk about the different parameters that we're gonna have to choose. And this is super easy in this case, even easier than we had for the plus, I think. Okay, so you're basically just choosing RF power and cutoff temperature. RF power. We want to increase it gradually. You can see it in a minute, okay? But generally speaking, 35, 40, depending on treatment room temperature, it has shown to have quite an effect on the speed of temperature increased. So if your room is relatively cold, you might need higher RF power, but remember, we don't want to use too high power because increasing the skin temperature too fast would cause your patients discomfort, and we don't want that. We want to be able to deliver a comfortable treatment for your patient, to be able to extend the treatment time as much as possible, okay? So the longer the treatment, the better the results. And if patient will be uncomfortable in the very first few minutes of the treatment, then it'll be impossible to extend the treatment for 45 minutes. And yeah, and here on the top, once you're ready, once treatment, everything is set, you're pressing the play button, and then you have a countdown, or not a countdown, but the elapsed time is showed here, and just gives you a really nice monitoring. Once it reached the defined treatment time, then it stops the RF, okay? So you don't have to worry about that. And different treatment areas that could be targeted. As we said, we can target basically all body areas. And I'm just going to say what areas we're not targeting, because I didn't even imagine that we're going to have to say no. But since we have received a picture like that, I'm going to say this. The Evolve system is neck down, okay? We don't want to see any tight applicators tied around the neck or anything like that. It is not aimed for that. For facial treatments and submental treatments, we offer the Evoke system that provides really good solution. So we're talking about body treatments here in this case, okay? And basically any body area that you can create good enough contact of the electrodes with the skin is acceptable. And you can also target different areas simultaneously, okay? And this picture really shows it very well. So you can target abdomen while working on the arms. And the question that normally arises at this point is, can I work with two different types of applicators? Meaning, can I work with the tight and the trim at the same time? And the answer is no. So you can work different areas with the same applicator. You cannot make a crisscross with the different applicators, okay? So you choose one applicator to work with at a certain time. Yeah, so the protocol is very straightforward. So because we're talking about epidermal and dermal heating, we're talking about thin fat layer, thin fat areas, and in these areas we want to use relatively lower RF power. Again, for smaller zones, lower power. Cutoff temperature should be set to as high as possible. And as with the Platforma, I recommend it to be 43 in this case, because it feels like hot stone massage. It's really nice treatment. Patients are not suffering any discomfort during the treatment. It is nice for them. They're enjoying it. They can actually fall asleep during the treatment. Everything's nice and easy with this one. And then, as we said, gradual heating is recommended just in order to make sure that your patient is comfortable. If you're moving from 35 skin temperature to 43, just like that, it would be perceived by the body as an aggressive stimulation and not as painful stimulation. Okay, so you want to avoid that. With regards to treatment regimen, 3 to 6 treatments are recommended for 3 to 6 weeks. Personally, I think very similarly to what we talked about with the Plus applicator. Okay, so 1 treatment per week, and longer treatment, better results. Minimum of 30 minutes per zone. And because you're not actually working there, your entire work sums up to the very first minute of the treatment of installing all units on your patients, and that's it. That's when you're done working. So the longer the better. As long as the patient can sit that time and can pay on that time, give him the longer treatment rather than the shorter one. So post-treatment, what do we see? We see an erythema, a slight edema. We do not want to cool down the skin because we want to let the residual heat do its thing in the body and on the body. Okay, you can moisturize the skin, and as we said earlier, sunscreen is always advisable. Again, this is something that we see. The post-treatment is quite similar to all of them, so I might not be going through the details with the rest of the applicators. Let's just check if we found a solution with the videos, with the links to the YouTube videos. Okay. No, but it is there. So if we can, okay. It's definitely there. I uploaded it myself yesterday, so it's definitely there. But if not, we'll also you can give us that feedback later on, and worst case, we'll send links. Yeah, you can find it. Erez Dayan, Evolve, in mode solution. Just look it up on YouTube. A little bit of before and afters. So yeah, we kind of discussed that. So let's move on. If tight is clear, then let's move on to the trim. Now, I really wish the tight is clear and comprehensive, because if that one is clear, then the Evoke session later on today would be really easy to cover, because it's exactly the same, only on the face. So let's make sure that we don't have any questions here. We don't. Okay. So yeah, let's move on to the trim. So the trim applicator is based on the proven technology of the body effects and mini effects. Okay, so this is if the tight is based on the Forma and the Plus, that is proven and has multiple studies to back it up over the years, multiple years of experience. Same goes for the trim. Okay, so we're talking about body contouring and cellulite treatment, but hands-free. In this case, we're talking about 6 different applicators that combines RF, radio frequency, and vacuum. Okay, it is a patented technology by what we offer here is a patent technology of InMode. And as before, as with the type, we can work on different body areas simultaneously. Again, we cannot combine the different technologies, okay? So you cannot work tight with the trim, but you can work tight, different body areas, and then trim different body areas. Pre-treatment, as I said, we kind of covered it before, so I'm not going to read through it, but it's super important that no lotions, makeups, and stuff like that are used in this case because of the vacuum. Okay, so because the fact that we have vacuum, any cosmeceuticals like that on the body would have much higher potential to damage your applicators. So make sure to keep it clean and safe for your applicators. Okay, and this is also something that is very, very important for the cream applicators. So we are not recommending, because we're talking about vacuum and because the chamber, for those of you who've known and worked with the body effects, the chamber is kind of deep, okay? It enables us work on a relatively deeper plane of the body. We're talking about the subdermal fat layer in this case. It actually sucks in quite a chunk of your tissue. So what we want to make sure before that, we wanna perform the thickness test. Okay, we wanna make sure that we have a layer of more than 2 centimeters or 1 inch in the treatment area. Okay, and this is something that is super important because otherwise, if you're working on areas that are too lean, then you might be causing side effects that you don't want to do. Okay, so a pinch test with a caliper is a must prior to the treatment area, unless for some reason you don't have it and you're suspecting a too lean area, then please avoid treating the area. And mainly I'm talking over the knee, above the knees, a relatively bony area. So avoid these areas because then you'll have side effects. Also important, because we're talking about vacuum, is shaving the treatment areas, and this should be done prior to the treatment. I would not shave myself, but I would instruct my patients to arrive shaved to the clinic, and that will be it. Okay, so this is very similar to what we've talked about before. Now, the one thing that is super different and super important is the fact that in this case, as the differences between body effects and Forma and Plus, we're not using any gel, any water, any oil, anything, because we have vacuum. Okay, so this would actually not only harm your patient, but will significantly harm your applicators. So completely avoid the use of any substances like that. And the treatment itself. So how exactly does it work? We're hitting up the adipose tissue. So with the help of the vacuum, we're actually targeting much deeper tissues than we did with the tight. So we're targeting the adipose tissue. We're increasing the metabolic rate again with the help of the heat and the vacuum, and we're causing that controlled thermal injury that damages the fat cells. The vacuum in turn also improves the lymphatic drainage and circulation, and generally better the penetration of the RF into deeper tissue. So this is generally how it works. This thermal imaging really shows nice, even heat distribution of immediately after a trim treatment. And you see that even though, because this is a question that that comes many times, immediately after you see the erythema, sometimes you see a slight petechiation because due to the vacuum, but what you don't see is the thermal the heat distribution within the tissue, because what you see is just the marking on the epidermal surface, on the skin, and then the patients are, well, that's not heated, it's not the entire tissue that's being targeted. Well, that's not true. So this pictures actually shows in many different demonstrations the fact that the distribution is very even across the tissue, even though there are slight gaps in between the units, and you'll see that. Okay, another very nice treatment, post-treatment picture that shows that even 15 minutes after the treatment, you still see very nice heating, epidermal heating and tissue heating. Okay, so if it was just epidermal, then the heat would the temperature would drop much faster. But because we're working on much deeper tissues, then the heat is preserved within the body and being released over time. Okay, and this actually shows, and this is FLIR is really nice thermal camera. You can work it with every smartphone, so if you want you can just Google that. But it's really nice. It gives you really nice effects. It shows on the top part it's the thermal camera, on the bottom part you see the regular camera, and it's actually the same picture taken in the exact same time, so it's really cool. And again, different treatment areas, so you can treat all body areas. I repeat, body areas, neck down, that has thick enough fat layer. Okay, so we're talking about, I remind you, minimum of 2 centimeters or 1 inch. And again, targeting different areas at the same time is possible. And this is how, as I explained before, okay, so I'm assuming I did a good job because you didn't ask anything about that. So it works in a similar manner, only this time we're controlling 6 units instead of 8. So the duty cycle is only 6 seconds instead of 8 seconds, okay? So 2 seconds per each, 2 seconds on per each unit, and then 4 seconds off. What is important to say at this point is that the trim applicators are working with cables 1, 2, 3, and 5, 6, and 7, as shown here. So you see cables 4 and 8 are not on that table, and this is because they're disabled for the trim units. So if you'd be connecting a trim unit to cable 4 or 8, it would not be recognized. So so this is something to really kind of, you have to let it sink in. It is a little bit confusing few first times, but I promise it does sink in. So cables 1 to 3, 5 to 7 are used for trim, not 4 and 8. It is written on the presentation, so you don't have to memorize it now, but you do have to practice it right. It is getting a little bit more confusing because actually on the screen it shows something different. We'll get there in a minute, okay? So this is very similar. I'm not about to repeat it. Okay, mark the treatment area in a standing patient, then apply the applicators. Only it's slightly easier this time because we don't actually have to apply gel, so it's slightly easier and quicker application. Okay, but we do have to make sure that we're allowing vacuum formation, because as with the body effects, if there's no good enough vacuum, there'll be no RF delivery. Okay, so make sure that you're positioning the applicator in a way that enables establishment of good enough vacuum. So if it's over the ribs area, you want to have to push it down maybe, or avoid the belly button area and so forth. Okay, and here it is. As I said, it is written. Okay, we're working with cables 1, 2, 3, and 5, 6, 7. 4 and 8 are disabled, and this is super crucial. And again, we're providing the patient with a call button immediately after we have checked it. Okay, so always check it yourself first. And the typical parameters. So what happens is we're starting at 25, because this is again in a very similar manner to the comparison between body effects and Forma, and plus when compared to the tight treatment, it's a lot less comfortable. So patient may experience some discomfort during this treatment, and therefore I recommend cutoff temperature normally lower than the standard, than the 43. Okay, so between 40 to 42 depending on the area, and start at 25, increasing the temperature according to patient's tolerance. Okay, and this is super important. As long as the patient is feeling okay, you can increase the RF level, but if they're complaining, then you want to make sure that you're in control. And never ever, whatever you do, do not exceed 15 minutes treatment time, and this is super important. Okay, So the maximum, and I'm going to repeat that, maximum treatment time in this case is 15 minutes. And this is up to you to maintain. This is very, very important. You're setting up the parameters, and then there is the preheat sequence, in which the system will deliver the lowest energy level to preheat the unit and bring the skin temperature to the electrodes, okay? Temperature, so to even it up, and that helps the patient with more comfortable sensation during the treatment. You do not have to make up for that treatment time, because the system does not count that preheat time in that 15 minutes. Okay, so this is something that is very, you will see a preheat time showed on the screen. And once, do we have a question?
Yeah, we do.
Okay, so just a second. So you will see the preheat time on the screen, and once one system discovers that we can continue, then it starts counting the 15 minutes. Yes, let's have a question.
Do you want me to help you with this, Shaka?
No, I'll open it because the double sound is a little bit annoying. Oh, we have a lot of questions. So I don't know which ones you've answered already or you didn't. Oh, I do know. Okay. So we have one question. What would be the complications if you did it on too thin areas, as mentioned when discussing above the knee? Okay, so possible complications on too thin areas is bad vacuum and bad contact, which we know may result in burnings. So avoid that. Okay, so all types of burning. It could be more superficial or deeper ones, but yeah. Can trim and tight be done on the same day on patient? Which will come first? Great question. I normally kind of go through it later on, but yes, all three applicators can be delivered on the same day. If I want to combine, if my aim, and we're kind of ahead of our time here, but if my aim is to provide trim treatment, I will start with the trim, 15 minutes, and then follow it up with 30 minutes of tight. Okay, absolutely recommended to combine the two. So I would never ever give a trim treatment alone. I might give a tight treatment alone, but not a trim. So trim, I would always want to continue up with additional 30 minutes of tight, because these 15 minutes are the initiation of the physiological response, and I want to prolong it using the tight applicators. Are the applicators numbered as well to match the cables? That's really good question. No, applicators are not numbered. You don't have to worry about which unit you're connecting to which cable. They're completely the same. So this is one less thing to worry about. Why 15 minutes only for trim? So as I said, because it is a matter of safety and comfort. So normally patients are not very comfortable after that time and may experience some side effect that we want to avoid, because it does work on deeper tissue. Fat, as you know, may reach much higher temperatures and accumulate the heat in that fat tissue, and we want to avoid that. So 15 minutes stops. What will happen if time is extended? Yeah, kind of answer that. And I think we can continue. Does trim have HVP like in body effects? Well, good question. No, it doesn't have the high voltage pulse, but it has other mechanism that enables you to work on a much deeper level. Okay, how are we? Oh, is there still sound coming from the machine during operation? Yes. Yeah. Same sounding systems, same signaling that you know from body effects and Platforma are also used on the Evolve and Evoke. Sorry, Mervyn. For tight, does the 30 minutes treatment also include the preheating? with the tight, we don't so much do the preheating. The preheating phase is mainly for the body effects, okay, due to the different techniques used. So for the tight, there's not so much preheating phase, and the time relatively to the treatment time that it takes you to get there is negligible. So normally, because I don't recommend a 30 minutes treatment time for tight, I actually recommend it longer time. Then I think these 3-4 minutes that would take you to get there compared to the entire 60 minutes treatment time is absolutely negligible. Okay, yeah, let's continue. So this is how it looks like. I mean, okay. Oh, no, I don't want to do that. Okay. So the trim treatment, as I said, as always, it can be paused by pressing the pause button here or the call button that the patient is holding. What's important here to see is that the cables, and this is kind of something that we started covering before, okay? So we talked about the fact that we're working with cables 1, 2, 3, and 5, 6, 7, but on the screen, as you can see now, what you see is 1, 2, 3, 4, 5, 6. So number 4 is actually connected to number 5, cable number 5. Number 6 is actually connected to cable number 6, sorry. Number 5 is connected to 6, and number 6 is connected to 7. So a little bit confusing, but as I said, it kind of grows on you, and I promise it will sink in. Yeah, and this is how it looks like. Now, unlike the tight applicator and unlike the body effects, in the trim units, we have a super unique heat control, temperature control, okay? So as you can see here, each chamber actually has 11 temperature sensors embedded in it, and this is all in order to maximize the safety profile of the system, of the units, okay? So these are the 3 main sensors, the ones on the electrodes, 1 and 2, and the central one. Additionally, we have these 2 central ones and 6 more units, okay? So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 temperature sensors in each unit, and this is super important. And as we saw, the treatment, the coding, the color coding increases during the tight treatment. We actually see different color coding for each small area in the trim chamber that helps us to prevent these exact same adverse events that we've talked about earlier. And the idea is that if anything, if within a chamber the temperatures are too far from each other, then this is a good monitoring for you as well, okay? And this would normally happen in lower fat areas. Post-treatment, very similar, but additionally what we may see is a little bit of bruising or petechiation of the skin, especially with older patients that tend to bruise easier. Okay, again, exact same things as before, so I'm not going to repeat them. And with regards to the treatment regimen, yeah, so very similar, but I want to repeat, not longer than 15 minutes. And as you guys have asked already, and I said already, treatment with trim should always be followed with the tight treatment, okay? So we're providing a 15 minutes treatment of trim, and immediately after we're giving an at least 30 minutes treatment of the tight to potentiate the effect. Now let's talk about the tone. And after covering the tone, I will move back to see the big pictures and talk about what makes this system so unique on the market. So the tone is an EMS applicator, electrical muscle stimulation, that again can be used on different body areas simultaneously if needed. Non-invasive, of course, the idea is you can actually increase the muscle strength, the muscle ability to contract. We are talking about 4 applicators, okay? So 8 for the tight, 6 for the trim, 4 for the tone, and they actually get larger. So you can pretty much cover the same treatment areas using just low numbers of applicators. And we can also treat multiple body areas at the same time. So the idea is to provide, to mimic the body's nervous system. So normally what happens is, well, we have the central nervous system, brain, and then the peripheral nervous system, spine, and everything. And there's the, and this is the correct pathway, okay? So brain gives an order, it passes through the peripheral nervous system into the motor unit that actually makes the action of contraction in the muscle, okay? So it's actually, it's also an electrical stimulation, but only from within. So what happens here is that we're kind of bypassing that and providing that electrical stimulation to the motor unit from the outside, okay? So we're applying the electrical stimulation rather than giving the order in our brains. And because it's in an external one, we can actually create it in a non-physiological way, which is faster and more and stronger, and get much actual how to say, sort of say better physiological work when compared to actual physiological work, okay? So because it's an external control, we can work and contract much faster. Yeah, so well, history is not as important as one may think, so with your permission. Basically, what I want to say about EMS is that it's, first of all, yeah, it's an FDA cleared device, safe for weekly use, and it's clinically proven. And this is actually the only applicator that is brand new to InMode, but it's a technology that has been on the market for many years, and it's very well proven, and we actually see the results. And unlike tight and trim that we're going to have to be patient with, tone you can see the effect immediately during the treatment, okay? Because you can actually see muscles contracting. Okay, so as before, so I'm not going to read through. We want the units to be completely dry, and in this case also test the cold button, okay, before you're giving it to your patient. We're using gel, again, either directly on the electrodes or the treatment area. Personally, I like on the electrodes. Whatever is comfortable for you is acceptable with me. And the treatment, very similar, okay? So you wanna adjust, in this case, it's not so much mark the treatment zone because it's not as specific, because we're gonna work a group of muscle, yeah? So, so what you wanna make sure is just that you're adjusting the belts correctly, and that enables the units to touch the screen properly, because the coupling here is also very important. Okay, so let's talk about the screen a little bit. So the tight units actually, sorry, not the tight, the tone actually works with cables 1 to 4, okay? So 1, 2, 3, and 4. Cables 5 through 8 are disabled for the tone treatments, okay? So you can work with 1, 2, 3, and 4, and these are actually paired up in a manner that one works. You can control the intensity of 1 and 4 together, and you can control the intensity of 2 and 3 together, but separately. So as you can see here, you can control these separately to these ones, okay? And the idea is, the easiest way to explain it is imagining the abdominal muscles, okay? So if I'm working on the abdomen, I have a group of 4 main muscles, right? I have the rectus abdominis going like that, which are the 6-packs, also known as 6-packs, and then we have the oblique muscles on the sides, and the broad muscle, okay, the broad abdominal muscle. So the the different muscles require different intensity to work. Okay, so you can all agree that the side crunches and the crunches that we do are not exactly the same. Okay, so they have different intensity, different muscles have different capacity. So the idea is, if I'll be working on an abdomen, 4 applicators on an abdomen, for example, I'd be working 1 on the oblique, 2 and 3 on the rectus abdominis, and then 4 on the other oblique, on the other side. So then I can control different groups of muscles. Okay, so 1 and 4 would be 1 intensity level, and 2 and 3 could be theoretically worked at a different intensity level. So same goes for, let's say, thighs. If I'm working inner thighs and outer thighs, or something like that. So inner thighs are slightly less tolerate higher intensity, are less tolerated in the inner thighs, and so forth. Okay, so this is the idea that you can work different areas, different muscle groups at the same time. Okay, and the system, the treatment setting, the parameter settings during this treatment is slightly different, and in this case, it's different than everything we've done so far. So in this case, the communication with the patient is super important. You kind of have to, you will have to increase the intensity slowly until the point that you actually see these contractions. Now, something to understand about muscle contracting, it's an all or nothing response. Okay, so it either contracts or it doesn't. So it either accepts that the command, electrical stimulation from brain or from an outer stimuli, but it either does or it doesn't. So as soon as it contracts, it works. So as soon as we see contractions, it means that we work. We might be able to see stronger contractions, but it's as we said, it's an all or nothing response. So once it contracts, muscle is working. And if patient cannot tolerate any higher parameters, that's fine, because we're still working out the muscle. So what we do is want to increase the intensity levels gradually. Normally we start at around 2, 3, 5 intensity levels, at which point most patients will feel what we call tense. Okay, so it feels like tingling effect on the skin, maybe like mini electrical pulses on your skin, which is not a nice feeling. We want to pass that phase into the phase that patient is feeling less of that and more contraction, and actually to the point where we can see the contraction. Okay, and we do that by a gradual increase of intensity, and this is super cool. And normally after working several minutes at a certain intensity, muscle kind of get used to it, and you can start increasing it again carefully. Also, another thing that we see is that the stronger the muscle, the higher intensity it tolerates. Okay, so a patient that comes in and they tend to work out and they have higher muscle mass, then can tolerate higher intensity level. And this is how it looks. Now let's talk about the schedule, treatment schedule. What I didn't talk about is the maximum intensity. Well, it goes up to 50, but we never get there. So most patients will tolerate, standard patient will tolerate a treatment of between 15 to 20. The stronger ones would tolerate 22, 23. This is approximately the intensity levels that we are working in. Time of 15, 20 minutes is good for most patients. Now let's talk about the treatment schedule. Okay, so the official line is number of sessions should be 3 to 6 sessions, in a similar manner to what we provided with the tight and the trim. Personally, and this is my personal recommendation to you. You can take it or you can toss it aside, whatever you choose. But I think of it, because what we're doing here is mimicking body's physiological response. Okay, so try to think about what you need to do in order to get yourself stronger. If you're doing a workout program, okay, so you won't be working out just once a week. You'd be working out at least 2 or 3 times per week in order to get good results, especially if you want to get it in shorter time. So this is my personal, I believe. I want to mimic the outside event and put it on what happens in my clinic, in my treatment room. So this is what I personally think of these kind of treatments. And it's not to say that 6 sessions and we're done. Okay, so this is muscle working out. We always have to keep them working out. So again, depending on your patient needs and expectations, if they tend to just boost things up and then continue with standardized working out program, or if they want to continue that for months or whatever, that's possible. It's not to say that more than 6 sessions are a big no. You can absolutely go on, but they're just going to have to pay for that. Post-treatment, surprisingly enough, we do see erythema. It is not heated up. The applicators are not getting hot at all, but we do see transient erythema, and we don't want to cool down the skin. Now, the question that probably somebody will ask, and it's a good question, and if you don't ask it, then I'll give you the answers anyways, is yes, we can combine the tone treatment with other applicators, with the trim or the tight or both. Okay, the right way to do it is to start with the ones that are preheating the skin and then providing the tone treatment. Okay, so we're think of it as a Bikram yoga class. Okay, so we're heating up the environment in order to enable the body to work better and faster. But I want to take that minute now and talk about the idea behind Evolve. Okay, so actually the idea is that we can actually use one system, and I want to stress that out. This is the one system on the market that actually targets all different layers of the body. So epidermis, dermis, subdermal fat layer, and muscle. There's no other system on the market that targets all 3 layers. Okay, so this is, you have a system that does tightening, you have a system that does electrical muscle stimulation, and you have a system that does fat burning, but you don't have a single system that can do all 3 different treatments, and definitely not on the same day. So think about what you're getting here on that aspect. The second thing is that it's designed to match the needs of all your patients. Okay, so a patient can come in all sizes and shapes, and some might need body contouring, to which I will give a trim and a tight treatment. And if afterwards they want to tone up their muscle, then once targeted the first problem, we can then provide treatment for the second thing that bothers them. A patient can come in just with a little bit of loose skin, and then they might need just the tight. So it's really something you can and so forth again with tone. Okay, so it's really something that you kind of you wanna observe at your patient. You wanna ask them what bothers them most. Sorry, and then make the adjustments. Provide a different treatment program to each of your patients, because there's no one thing that is true for everybody, and you're really gonna have to adjust your program to your single patient. And this is like a nice recipe to combining the treatments. Okay, so 15 minutes of trim, then at least 30 minutes, better if longer time for tight. For only loose skin, this is for fat reduction. For only loose skin, we're going to use the tight applicator, even up to 60 minutes. And for muscle toning, we can use the skin remodeling with the tight and then the tone. Okay, yeah, I think let's think we're done. Let's see the questions. Oh, we have a lot of them. Let me see them. Just a second. Okay, so is it possible to make the time treatment longer than 15 minutes with the trim? No, as I said, we recommend a treatment time of 15 minutes tops with the trim in order to avoid any complications. How long can we use the units probes? Do you mean how? There's no limit, okay? So you should be able to use them for many years. So as we know now, there's no limit. They're produced for longer usage. What is the frequency? The frequency of the tone. So the frequency actually is I don't have a good answer for that. It's a good question. Please email. Please write that down in your survey, okay? And I'll come back with an answer, okay? So sorry. Does it allow a muscle to reach supramaximal contraction? I mean, tetanic contraction without relaxation time. Yeah, it does allow a supramaximal contraction, absolutely. Why does the patient not get pain in the muscle in the next, wait, kind of lost it. Why does the patient not get pain in the muscles in the next couple of days like they would? Oh, they do, they really do. They should. Most patients, if performed properly, most patients do report a muscle ache, same as after a workout, okay? The day post-treatment or few days following the treatment. Do we have any comparison table for tone, trim, and tight? As you mentioned, there are lots of EMS devices, and I think we have to, okay, so this is something to talk about with marketing and sales, okay? So Judy says here that we do have it. Again, something to ask us in the survey, okay? So we should be able to provide something. I don't have it here with me. Is there an alternating frequency at play? No. Any soreness after tone treatment? Yes, as we said, most patients, if operated properly, then most patients do report a sore body after the treatment. I've seen same technology in other, okay, that claim there is a lipolytic effect due to the muscle needs to increase metabolic. Could it apply? Absolutely. Okay, so the question here basically is if we increase the muscle mass, does it affect the metabolism of the body? We are working quite locally, but yes, any muscle that increases in mass require more energy to work, and therefore increases metabolism, local metabolism. The higher the muscle mass in the body, the higher energy consumption, because when you compare the amount of energy to maintain a muscle when compared to fat tissue, then muscle requires a lot more energy. This is why we're saying fat burns or muscle burns a lot more calories than fat, okay? So a muscly person will automatically burn more calories per day and need higher calorical intake, okay? So yeah, it is possible to say that. Is the tone EMS similar to, I don't know, HIFM? Okay, so sorry, can't answer that. Is there an off and on time for the contraction? There is not something that you can control, okay? This is something that happens behind the scene. EMS from okay. Can you use tone? Can you use the tone applicator with copper spiral? I am not sure I understand your question. Copper spiral for what? Melissa, copper spiral for what? Meantime, let's answer that one. Is possible for the patient to use for mobile phone? Yeah, absolutely, can use mobile phone during the treatment, no problem. All of the treatments, RF, tones, does not disturb the treatment at all. It doesn't work on the same frequencies, so it doesn't interfere with that. So Melissa, just explain yourself here. If the patient has a copper spiral anti-conception, we haven't experienced any issues with that. It's deeper than we work, okay? So with regards to RF, I wouldn't apply, I wouldn't consider it as a problem because it's relatively deeper than the layers that we're working at. We're working either at the epidermal and dermal layer with the tight, or the subdermal fat layer with the trim. And with regards to the tone, we're just electrically stimulating muscle activity, so it shouldn't have an effect on a contraceptive copper spiral. Okay, so we have 1 more hour. I think today I'm sorry. I think today I will cover the evoke theory part immediately now, because it is very, very similar to the evolve. Okay, it really is working in the same manner. Well, wait, another question here. So just before moving on to the event, for the trim, your PPT slide does mention it uses, yeah, that's a mistake. My bad. Sorry, you're right. So Mervin's asking, it says the presentation slide does mention high voltage RF pulse, and it shouldn't be there. No, it won't be in the future. No, not as much as I am aware of it. No. Okay, so let's talk about the evolve. So very similar, hands-free facial remodeling system that uses bipolar frequency energy, again 1 megahertz, and it's actually the one system, the one hands-free system to target facial needs. Okay, so there are a lot of hands-free systems on the market for body treatments, but it's only the evoke for facial treatments. We have 2 different applicators, the cheek and the chin. As before, save your time, gives a reproducible protocol and results, increase the treatment time for better efficiency, and it is based on a technology that we already know and familiar with. So yeah, mechanism of action we've discussed, and no need to repeat that. And here it actually kind of shows how the current flows from one to the next. So what you see here is a demonstration of the cheek applicator, and you have 4 forma units on each side of the applicator, so altogether 8 applicators, similarly to the tight. Okay, so maximum of 8 can be worked at the same time, and the current flows from one unit to the next. It goes 2 seconds, 2 seconds, 2 seconds, 2 seconds, and so forth. Okay, and well, we've discussed that, so we can skip it. Actually, oh, sorry, didn't mean to do that. Again, same issue with the call button, so it's super important. It is a safety feature. You must check it. System would not work without the call button connected to it. Make sure that it works before you're handing it to your patient, and just before treatment starts, hand it to your patient to hold. And here you see the 2 different applicators. So on the left side, you see the cheek applicator, and with 4 forma units on each side, and on the right side, you see the chin applicator with 2 forma units to target subdermal fat layer. The angle here is adjustable, and well, here you can just adjust the size of the head, and there is a support to the chin. You'll see it in a second. Pre-treatment is very similar to what we've discussed before, so I'm not going to repeat that. Again, before and after, no lotions. Super important to take some pictures, before and after pictures here, because again, people forget what they came here to do. Okay, this is just a little bit about the applicator, not so much about the treatment. So as you can see here in this short video, you can disconnect the this part, the electrode parts It's just a magnet. So when working, if for some reason you're disconnecting it, make sure to reapply it in the correct direction because it is crucial. Okay, and also make sure that it goes on the same side, because otherwise it will not match what you see on the screen. Call button we've discussed, and again we're using ultrasound gel for both of them. So this is exactly the same as the former, so very, very similar to what we've discussed with the tide. Okay, we're using ultrasound gel to make sure that there's good contact, good coupling with the skin. You can apply it to the treatment's area or directly on the electrode, my personal favorite. As I said before, you have to instruct your patient not to pull the wires, okay, cables. When pulling the cables, it actually affects the positioning of the electrodes on the face, and this may cause it to lose contact. So instruct them not to pull, and you want to make sure that they're comfortable. Once this is applied on the face, you want to make sure that your patient is comfortable before you're actually starting the treatment, because they're going to sit with it for 45 minutes. Okay. Another thing to pay attention to, especially with the cheek applicator, is that this stabilizer thing, and this is this metal bar here, that we call the stabilizer, actually controls the angle of the applicator on the face. Okay, so for narrow faces, it has to be kind of pushed all the way towards the end, and for wider faces we kind of enlarge it. But whatever you do, you make sure that your patient is not leaning on it, okay? Because if they lean on it, it changes the angle. If it changes the angle, you lose contact. If you lose contact, you might get burns. Okay, and also in this case, we also have a set of belts, of 3 belts, and these also come in 3 sizes, and they're also designed for patient. Okay, so this is something that might take a few minutes first time around. Once you get used to it, you'll see that it's not as bad. It comes with 3 different sizes of belts. The longer one is for the chin applicator, the one that goes on top of the head. Then you have the medium one that goes here, and the smaller one that goes on top of the head for the cheek applicator. Okay, so 3 of them. It comes with the set of belts comes with instructions, so you don't have to overthink it. Yeah. Another thing to pay attention to is this silicone security strap here for the chin applicator. It kind of makes sure that the applicator doesn't fall and lose contact. So you have to secure it to your patient's chin, and that way you're sure that it's safe. Okay, so very similarly to what we've seen before, only now it's shown on the screen. We have the units demonstrated on the screen with the same coloring color coding system that we've seen before. You can also control the units from the screen. So the default is that number 4 and number 8 are disabled, because we've kind of noticed that most patients can't bear all 8 on their face. But if you want to enable them, and if you see that you have good enough contact or on your specific patient, then you can enable them just by pressing the number on the screen. Okay. Yeah, we've talked about this. So in a very, very similar manner to what we've seen before, and similar protocol, we're starting relatively lower energies and increasing as required and as tolerated by your patient. So the idea is to work at the maximum cutoff temperature. Again, if you ask me, you can easily work at 43 in these cases. And increase it, just make sure that your patient is comfortable. That's the one thing. And then you see the increase in temperature with the color coding system. Okay, same as Evolve. And this is again what we've discussed with regards to good contact. Okay, so make sure that there is good enough contact, and this you have to do prior to the treatment. This is exactly what we've discussed with the Evolve, okay? So you're not leaving your patient alone in the room until, not before you can actually see all applicators are working properly and achieve the cutoff temperature, because this is an indication for you that there's good enough contact. Yeah. Scheduling, similar to Forma, so a weekly session once a week for about 3 to 6 weeks is recommended. We have doctors in the USA and Canada saying patients are not compliant with these kind of treatments, and they recommend slightly longer treatments and meet their patient once a month. That works as well. We have some of that. So whatever is comfortable for you and your patient is acceptable for us. Immediately post-treatment is exactly what we know from the Forma and what we've discussed with the tides. So erythema, slight edema is acceptable. We don't want to cool down the skin. It is possible to moisturize the skin and so forth. And this is the thermal profiling as time elapses after the treatment. Okay, so this was the baseline. You can see the heat build up immediately after, so 30 seconds after, and you can see there is still some effect even 30 minutes after. Okay, so there is still, the entire tissue is hotter when compared to baseline. Yeah, so a little bit before and after, and this was taken with the Quantificare. So this is a software actually that measures fat loss and so forth. So you can see here there's a loss of almost 4 milliliters on the submental area, which is quite significant if you think about the fact that we're talking about a non-invasive treatment, hands-free. So all you do is set it for 2 minutes as an operator, and then it works for you. So it's pretty amazing. And again, here you can see the numbers. So but it does show that this is something, and this is written on the presentation here before, and I kind of skipped it, because we're working on prolonged times. We do have a possibility to effect on subdermal fat layer, and therefore for areas that we're absolutely want to avoid targeting fat layers, we want to consider our needs or parameters. So we want to lower the temperature or want to reduce the treatment time, and that goes on and on. So I think if we're good now, we can answer the questions and then move on to the hands-on part, which might be slightly more complicated today with the DO instead of a real-life patient, but yeah. Okay, so can you use trim because of the vacuum on patients with scar on umbilical hernia in the treatment area, depending on the degree? Okay, so it's not a vacuum that's supposed to be working as deep as the hernia level, okay, but it depends. There are different levels of herniation and different patterns of abdominal separation kind of thing, especially for women after birth. But you theoretically you are able to work there. I wouldn't, if there's a hernia, I wouldn't put it above the hernia itself. Okay. Do you advise the patient something about diet or sports parallel to the Evolve treatments for maximum results? This is $1 million question. I think all of our patients, whenever they come for body contouring treatment or facial treatment, they should always be advised with the more holistic approach, okay? Because if a patient come in, let's say, let's talk about Lumeka, for example. So if a patient comes in and want to treat their pigmentary lesions on the face and then go and lay on the sun unprotected and for half a year, and then they come back to the clinic and complain it didn't work, it all came back. So, well, of course it did. Same goes here, okay? So if a patient comes in for trim treatment and want to reduce circumference and all, and then go and shove a full pizza every night, then there's nothing I can do for them, okay? It always should be accompanied with some lifestyle changes and some how to say I'm missing the word here, but it should always be patients should deliver their side of the deal. Okay, yeah, they're paying a lot of money and they want to see the results, but I would not be able to affect the subdermal fat layer to an extent that they will be happy if they will go and chunk a pizza or a burger every night. So they're gonna have to do something. Sorry, would you please repeat how long the treatment is for which one? For the face. So generally speaking, we're talking about 30 minutes, 45 minutes, depending on the area. So here I would provide longer treatments. Here I would be more careful because I want to be more careful with regards to fat melting and targeting on this area. Okay. Yeah, I think we can go on to hands-on part. Yay, exciting. So no more screen sharing. That's the one thing. And we have to change cameras and we don't have much time. So we do have few minutes of organization. So if you need that time, you can go and make yourself another cup of tea or coffee or whatever you need before we're getting ready. Okay. Not right now. So I don't know what's happening there, but I want to switch to my other camera. Yeah, here it is. Perfect. Okay. Whatever is easier. So a little bit of adjustments. So as we said, the first thing that we want to do is after setting up the system and all, the first thing that we want to do is measure our patient's size in order to match their belt, the belt to the treatment area. I will demonstrate the treatments now on the abdomen just because it's easier for me. So I'm thinking you guys don't see the screen right now, and yeah, you do. Okay. So I will just measure my patient a little bit. Normally I need some help from my patient. I'm hoping I will get the help I need here. Might be a little bit more complicated.
No. Let's switch it to the computer camera. We need to change the camera because this one is disconnected. It shows from here. Show. Where do you do it?
Okay. So I will just make sure that you guys can see better. So the first thing I do is measure the size, and as you see, the medium belt is not enough. So I'm going to combine it together with a small belt, which is my personal favorite because I think it gives me a very good control on the sizing and all. So once this is ready, I can kind of turn it around and use. Oh. No. No, normally what I want to do now is I want to check how many units of the applicator could fit on the treatment area. So I'm going to take the type unit, okay? So the types arrive in this suitcase, in this really nice suitcase, and I have 8 of them. And again, video stopped. So, okay, so we have the types, units. Oh, not the right one. Okay, variables, webcams. Sorry, the thing is, one of the issues with getting a good camera is that currently the entire world has switched to webcams now, and with the Zoom kicking in and all, it's absolutely all stores are completely sold out with good webcams. So that's another effect of the corona. So we are trying to deal with what we have. So these are the type applicators, the 8 units. And what I want to do, if you see here, there's like a notch here that I can just insert the belt in this area here, okay? And this is exactly what I do when I kind of make sure that what I do now is I'm just checking how many of the units I can fit onto my patient's treatment area. So I think for this one, which is almost perfect, 4 is more than enough. What I want you guys to see just before we're continuing is, I don't know if it's shown here, but yeah, you do see it. You see the red dot here on the top of the inlet here. This is the red dot that you're matching on the unit to the red dot on the connectors. So the next thing that I want to do is I want to apply gel onto the units, okay? So as always, Parker's gel. Do you have questions? Okay. So a little bit of gel. Now at this point, this is what I said. You can either apply the treatment gel on the gel on the treatment area, or you can apply directly on the applicators. I like to do this thing, especially with the type. I think it's the easiest. And then I can apply directly on the applicators. I can use less gel. I can put the minimum amount needed, and it doesn't get too messy around here. Make sure it covers the entire electrodes. And yeah, so once I'm done that, I can apply these back onto the treatment area, and I want to tighten it a little bit just to make sure that it doesn't move during the treatment. Now would be a good time for me to because I'm sorry, but because it's not a real life patient but a silicone one, then it moves a little bit, and my apologies for that. But now would be a good time to connect the units to the cables. So for the size, if you remember, it doesn't really matter if I'm working with units with cables 1, 2, 3, and 4, or 5 to 8. Normally, when working with more than 4 applicators, I want to make sure that I'm working in a symmetrical manner. So let's, for the sake of demonstration, I'll be using 1, 2, and 5, and 6, okay? Because I want to demonstrate what I mean by working in, simultaneously, you know, both. Sorry, I'm having a really stupid moment here. My bad, I'm missing a word in English. So What I want to do is I would connect cables 1 and 2, so the current will flow from 1 to 2, and then I would connect cables 5 and 6, so they'd be working in the same direction. Okay, and this is another thing that gives my patient a good sensation during the treatment. Now, it doesn't really matter. Okay, I can work with cables. In this case, in this instance, I can work with 1, 2, 3, and 4. It would give the exact same result. Okay, so each unit would work 2 seconds on time. The heating profile would look exactly the same. I'm just demonstrating as if I had more than 4. Okay, so I'm going to connect
Symmetrically.
Symmetrically, yes. Thank
you, Hannah.
Thank you, Hannah. So yes, symmetrical filling. That's the one I was missing. So a symmetrical filling is nicer on the body. Okay, so same way, if I'll be applying units on the left arm, I would want to apply them on the right arm as well. Okay, so keep it symmetrical. Thank God you're an early bird. Otherwise, you won't get that support. Okay, so working symmetrically, meaning that if the outer one is 1 and the inner one is 2, then it should be 5 on the outer side, and then 6 on the inner part. So yeah. Just because I kind of skipped that part, I don't know. Well, can we come closer?
Yeah.
So yeah, you kind of see the red dot on the connector and the red dot. Yeah, now you see it. Perfect. There's a little red dot on the connector right here, and then one on the applicator right there. Yeah, right there. And these should be matched together in order to be connected. Okay. So that and the reason why we call it push and pull connect. Push and pull is in order to connect it, I'm just pushing it in. Okay. And in order to disconnect it, I'm kind of pulling that part of the connector slightly and pulling it with 2 fingers, pulling it and disconnecting. Okay. So now we can look at the treatment screen. Now, after connecting the cables to the unit, I can look at the treatment screen. It has to be connected first, then choose treatment. The system recognizes the units that are connected, whether it's the type, the trim, or the top. Okay. It also detects the cables that are connected at the moment. And as you can see, cables that are connected appear as black. Cables that don't have units connected to them appear as gray. If I want to disable a unit that is connected, I can press on the number on the screen, and now number 6 is disabled. When do I do it? Again, as we discussed earlier, if for some reason I don't manage to get good enough contact or something like that, or the system, the temperature doesn't rises properly in accordance with the rest of the units. So I'm adjusting the treatment parameters. The RF power can be set to 35 initially, and cutoff temperature, as I said, for plus, for tight, 43, and treatment time normally 45, 60 minutes if I'm giving only the tight treatment. Now I want to test the call button. Okay, so the call button, if you remember, is on the back here. I want to test the call button before I actually start the work. So what I do is I press play and I press it. And by pressing it, it actually stops the treatment, okay? At this point, I actually give the call button to my patient to hold, and I press play again. And you see that they're working parallelly, okay? Number 1 works parallelly to 5, number 2 works parallelly to 6. These are not connected at the moment. And you can also hear the signaling, the audible signaling that you already used to from the Forma Plus and other applicators, okay? I will not continue the treatment, and because as we said, we talked about silicone patient, and I don't want to burn her up. So this is how it looks like. You also have very, very good measurement of the temperature. I can actually show it to you in a minute. So I will pause the treatment now. And you've seen the video of how the temperature are rising. I will take the units of my patient, and I want to show you the temperature reading on the screen. Okay, so just a second. What questions?
Yeah, is it possible to replace applicator during the treatment? For example, fault one, would it be recognized?
Yeah, fault one should be recognized. Either not recognized at all, or not rising the temperature properly. If it's not possible for you to adjust, then yes, I will replace them. It didn't happen to me, and I worked with many different units and applicators and generations of them, so I don't reckon it happened to you, but in case it happens, then yes, it is possible to switch between them. So what I want you to see is I took unit number 1, and I'm just applying it on my hand, and you can see the color changing on the screen immediately, okay? So this is really good indication that temperature sensor is working properly and nicely. And of course, if I'll be working the system now, I will see temperature rising further, okay? This is really nice. So post-treatment, again, not really shown here, but erythema, edema. I wanna clean up my patient from all gel residues and also clean up my applicators with alcohol. Okay, so let's do that and move on to the trim. Do you have questions? No questions. Okay. So back to my menu. I will skip you that time of the cleaning, okay, because I can do that later on, and I will just clean up my patient so we can move on. Because as you remember, we have to use the cream applicator on a clean skin. We don't want any gels and stuff like that, gel remaining on the skin for the trim, because we're working with vacuum, and that will completely destroy our applicator. So we want to avoid that. Okay, so our patient is now clean. I just remind you to clean the units, which you don't see here. The unit, I first remove the gel, and then I wipe it off with alcohol soap gauze, 7% alcohol, which is rare to find today because everybody wants that. So hope you have some in your clinic. Okay, so I'll be using the trim applicators now. So again, first thing I do is measure the size of my patient. I will demonstrate. I will demonstrate the same treatment area, abdomen. Okay, and first of all, I'm measuring the size, adjusting the belt as I need, and then check how many applicators I can fit. Okay, so these are the applicators. They look slightly different than the body of X, you know, but the chamber size is exactly the same. And I remind you, it has 11 temperature sensors embedded within each unit, which is super cool. Again, in this case, we have the red dot on the applicator, and we're gonna have to match it with the red dot on the connector. Okay, so matching them together. and clicking them in. Now, I will not do that because I want to first apply the units onto my patient. So, again, I have that slit here that I can apply on the belt, or the belt into it, actually. I want to avoid the belly button, just to make sure that I have good enough vacuum. Now, first time around when you're turning on that applicator, you'll hear a lot of fanning vacuum sound. Don't be scared. Just practice before your first patient, okay? So make sure that you're aware of how it sounds, because it does sound slightly different than what you know. They're all kind of working together, or one immediately after another, and it sounds funny, but it's okay. I remind you, we're working with cables 1, 2, 3, and 5, 6, 7. So again, I would want to work in a symmetrical manner. So in this case, it's actually necessary, because I can theoretically I can connect cables 1, 2, and 3, and then connect cable number 5 here. But then it would feel weird for the patient, because you have 1 and 5 working together, and then 2 and 3. Alternatively, I can work 1 and 5, and 2 and 6, and then the current will just flow back and forth in a symmetrical manner. Okay, so now I'll be connecting them, matching the red dot to the red dot. And using number 5 and number 6 here. And now I will enter the treatment screen again. Okay. As we said, the system recognizes the applicator that is connected. And I repeat, no, you cannot connect 2 different types of applicators at the same time. And now the screen shows like that. Okay, so the units that are not connected are shown disabled as gray. The units that are connected are black, or will assume the temperature, the skin temperature as soon as it touches them. But because we're talking about a doll here, then it literally is cold dead cold, I have to say. So, and you see the first we're starting with the preheat. Okay, so we talked about starting relatively low parameters, 25 power. Cutoff temperature should not be set to as high as possible, because it's less comfortable treatment. And I remind you, treatment time should be no longer than 15 minutes. Okay, again, I would want to test the call button just before I start the treatment. I would press play and stop it using the call button. Okay, as soon as I find out everything works properly, I let my patient hold it. This is really, really important. Now, system recognize high impedance, so I won't be able to demonstrate a treatment here. It also doesn't generate good enough vacuum. This is how it looks like, and you will see the temperature rising in each of the representation of the temperature sensors separately. And this is really, really nicely shown, and you can use it to monitor your treatment and make sure that it actually operates correctly. So unfortunately, I cannot actually demonstrate any further than that using the body effects, because as you can hear, it stops me. So I would stop it here, and we'll show now the tone applicator. So if you remember, for the tone applicator, we've discussed about the cables that we need. Cables required to work with the tone applicators are 1, 2, 3, and 4. So I've made sure that I have these ones ready to be used. Again, just quick word about cleaning the applicators. Alcohol soaked gauze and cleaning inside the chamber as well. Okay, just make sure that you do that after every treatment. So stone applicator comes like this. Actually, they come like this one. So these are the ones that you will see in your clinic, not the ones with the white. Okay. I'm going to demonstrate using these ones. You have 2 electrodes, and as we've discussed earlier, we can control them separately. Now you see one difference already is that to work with the trim, we're going to have to use the buckle because they don't have a slit to insert the belt in, but they're going to have to be attached to the buckle. So there's going to be a little bit more adjustment now done. And yeah, normally for most patients, I see that the medium-sized belt is working good, and I can work with that one. Of course, larger patients might need the larger belt or any combination of the medium and large, or medium and small. Sorry, but I do that. Okay, so I prepare it beforehand. I make sure that the Velcro side is on the outer area, on the outer side, so it'll be easier for me to tighten the belt if needed during the treatment. And then I apply it around the body. Yeah, here we go. So after doing this, I want to tighten it up and make sure that I have good contact. And also, as before, I want to apply ultrasound gel. So again, it's up to you whether you are applying it onto the body or onto the electrodes. Personally, I prefer applying it on the electrodes. So I disconnect it for a second, apply the gel just a little bit to create good contact. We don't need a lot of gel. That will be more than enough. And putting it back in place. Okay. Now that this part is ready, I can connect the connectors to the units. And as you remember, we have 2 pairs of units. So 1 and 4 are paired up, and 2 and 3. So because I'm working on the same muscle group here, I can choose just 1 pair. So either 1 and 4 or 2 and 3. So I'll be working with 1 and 4 now. And we'll move on to the treatment screen. Again, red dot match to the red dot. So treatment screen. Okay. No? Okay, so as you see, 1 and 4 are detected. These are the ones that I've connected. These are not connected and appear as gray. If I want to disable, I press the correct number, and then I start the treatment. Okay, so we've talked about the treatment time, 15, 20 minutes, something like that, and intensity levels. So as we said, we can control intensity levels of 1 and 4 together, but separate then 2 and 3. Okay, so as I said earlier, we're going to increase gradually. I don't know how our model force there will take it, but let's try. Okay, so what I do, is I normally start at around 5, and that's where I start my increase gradually. Okay, so I want to increase it gradually. At this point, normally most patients will still experience the tense sensation, the tingling effect on the skin. Normally at around 9 to 11, we will start getting the reports from our patients that they're feeling less tense and more muscle contraction. But as we talked about earlier, what we want to get is to the point where we're actually seeing the contraction, and this is normally between 12, 13, 15 and above. And this is also the tolerable intensity levels by most, 15 to 20. Of course, I need to press play, but I will not do that. So I think we're done. With regards to treatment regimen and scheduling about the Evoke, you have it all in your handouts and everything. So yeah, let's move on to the Evoke. Sorry, Evoke. So the Evolve system, setting up the Evolve system is much easier when compared to the Evolve. It's quite straightforward. We have the cord on the back and the connectors here on the top. Okay, so you don't have to actually connect all 8 cables, but you're connecting only 2 for the cheek and only 1 of them for the tone, for the chin. So again, same goes with the call button, same connector as we know from the foot switch, and you have a place for it on the back of the system. And let's turn it on. Or not. It did work before. That's it. Okay. We don't have much further, so bear with me. In this case, system actually doesn't recognize the applicator that is connected. Adjust the camera. So system doesn't recognize, unlike the Evolve. So we have to make sure that we're choosing the correct one. Again, in this case, we're matching the red dot on the connector to the red dot on the inlet on the back of the system. Now it is the cheek that is connected. Okay, so I will press cheek. And as we've seen before, the units are shown on the screen like that. Okay, so we talked about number 4, number 8 default that they come as disabled. Let's say that my patient is a round face enough, then I'll be able to work with all 8 units, so it would look like that. I normally start with relatively low RF power because we are talking about the face and the tissue heats up much faster. So I can start off with 25, 30. Cut-off temperature for all I care should be 43. And the treatment time at least 30 minutes. Oh, that went up too fast. Here we go. So at least 30 minutes. Do we see it? Not really. Okay. So I think I will demonstrate it on myself because it will be much more difficult for me to demonstrate on our patient as she's wearing a wig. And yeah, so as we talked about, this is how it looks like. This is the cheek applicator. Okay, we have the stabilizer on the back, the metal stabilizer. For narrow faces, this should be pushed. Okay, video is gone.
Reference.
So for So for narrow faces, this stabilizer metal bar on the back should be closed all the way in on both sides, okay? And that enables better fit. For rounder faces, I would want to open that, and that enables wider opening of the whole unit, okay? Since myself, I have relatively narrow face, I would already tuck it in. Okay, and the right way to go is for the cables to go on the back, close to the ear area. Okay, sorry, and yeah. So this is how I apply the gel onto the units or onto the face, and I would make sure that it sits. Again, removing all makeup, lotions, and stuff like that. So what you want to make sure when adjusting this one is, Julie, let me know if you can see properly, okay? Second. Yeah, okay. So I want to make sure that the stabilizer is pushed all the way in if needed. I want to adjust the belt size on that area, and I want to adjust the belt size on the top of my head as well. And the next thing I want to adjust would be the positioning of that plate that actually holds the electrode. Okay, so it can go around and around like that because it just sits on the magnet. So I want to make sure that it kind of holds for good in place. And as a therapist now, I would look around and go over and see that I don't see any electrodes. Okay, so you can kind of see it on the screen. Okay, no electrodes are shown. Okay, another thing I would want to check on the back that it's not showing. Okay, number 4 and number 8, because they also tend to lose contact. And I want to, if you remember, I want to instruct my patient not to pull these, because what happens when I'm pulling them, I lose contact. So yeah, after doing this, after making sure that I have good contact, that it sits properly, everything is okay, just make sure that the patient is not leaning on the stabilizer on the back, and you can start the treatment. Again, check the call button. If it's good, give it to your patient. And yeah, and that feeling that it kind of squishes your face, that's a good feeling. Normally when you have that, it means you're also going to generate good enough contact. If it's missing, then something is wrong. I do recommend you guys not to open this thing, not to play with it too much, okay? So it's not like super flexible, and shouldn't be. It should be holding that the mask in place, okay? And this is how it was designed. So just make sure that you're not kind of overstretching it. Yeah, let's talk about how you apply the chin applicator. So I'm going to switch to the chin applicator. I'm going to disconnect the chin and connect the chin. The chin applicator should be connected on the right side. And again, red dot to red dot. And I will choose chin. Okay, so you see we have two former units, and if you look at the applicator, we have the belt that goes on the top of the head, and we have that silicone belt that's supposed to be holding it in place on the chin. So this is how it looks like. And again, I'm applying the gel. And that's my personal way to apply it. So I apply it on the patient's submental area, and then I apply the belt and adjust the size of it. Okay, so that's what I do. And what I do next is making sure that this strap holds it in place, because if I don't have this one, then I'll show you what happens. This falls, okay? It kind of falls over, and then I lose contact. And same goes here. So I think it's kind of self-explained after we've covered the tight, well, after we kind of covered the tight properly, or the forma and the plus properly, and then covered the tight properly, the evoke is pretty much self-explained. It's just for you to practice really how to apply it onto different patients, onto different sizes of faces and shapes and all. And this is what you need to learn. And this is something I cannot really convey from the far. I do hope that I kind of explain the ideas behind these two systems, two amazing systems, the Evolve and the Evoke. The body contouring, the hands-free body contouring, and the hands-free face tightening systems. They're super unique, super effective, and are really, really exciting. So I'm hoping things were clear. If not, you can email us. And that's it. Thank you for being with us today. Again, goodbye, everybody. Oh, just sorry, I didn't check if we have any questions. Yes. So just few questions, and then we can. Does the Evoke give an alarm? Wait. Ooh, we have a lot of questions. If you're working only 4 applicators of tight, using applicators 1 and 2 and 5 and 6 symmetrically, does that mean that the treatment cycle is now only 4 seconds? Great question, Marvin. No, no. When working with the tight or the trim, or for that matter, the cheek applicator, let's say, and we're disabling some units, or some units are not connected, then the cycle, the 8-second cycle for the tight or the 6-second cycle for the trim will always remain. Okay, so if I'm only working with cables 1 and 2, then 3 and 4 are dead time. They'll be always off. There will not be an on time for these applicators, but the 8 seconds duty cycle will not change. This is something out of your control. This is something that is done behind the scenes, and we don't want to rush it, because the tissue also needs the cooling down time. Okay, because as we said, when working with the predicate applicator, with the plus applicator, we're moving constantly on the skin. If we'll be standing on a certain point and constantly hitting it up, that will not be good, not for results and not for side effects. So always will be 8 seconds duty cycle for tight, 6 for trim, and similar manner on the Evolve. Could you show configuration when combining 6-packs with obliques abdominal muscle? I think what you meant is, okay, so this is a question for the tone. I kind of rather demonstrate it on myself. Okay, so what I would do, which is not the best, as I'm quite pregnant by now, and video got stuck again. So just a second, let us fix that. So the question was about what do I do when combining oblique muscles and 6-pack, so the rectus abdominis muscle. So if I'm working on these 2 groups of muscles, I would want to work the oblique muscles and the rectus abdominis. So I would work applicator 1, applicator 2 and 3, and applicator 4. So that 1 and 4 are controlled separately, and 2 and 3 are controlled separately. And I would start with increasing. Them simultaneously. Start at 5, and then gradually increasing to 9 and 10, moving past that tense sensation, and getting to the point where I get the minimal muscle contraction. Okay. At this point, I might already be seeing some different intensity levels, because these might need higher intensity or lower intensity when compared to the rectus abdominis. So at this point, I might already see some differences. Not necessarily, okay? It might be shown, not in all patients, not always. So it's something that it's really depending on your specific patient. I hope that made that issue clear with regards to tone. Does the Evoke give an alarm if the contact between the skin and the RF sensors are not correctly in contact? Yes, so it's similar to what we see with the Forma and the tight applicator. We get sound alarm. Even before that, you'll have your patient alarming you, because it's really not, if you don't have good enough contact. Let's say if you have contact of just one of the side electrodes instead of the two of them, then you'll have a heat buildup on the one that is touching the skin, right? The skin, sorry. So on that area, you will have what we call a hot spot. So your patient will be feeling the difference as well, and we'll let you know about it. But yes, you will see the difference and hear the difference. Can advise not talk so as not to lose contact? I think it's a smart thing to do. Normally I do definitely ask them not to laugh too much during the treatments, because it really does changes the shape of the face, and not to talk too much, because again, first of all, they can't really hold the phone, and I do ask them to remove earrings and jewelry and stuff like that, and they can definitely not put an ear set. So it's just talking to us. So try to just explaining them that talking may harm the positioning of the unit is a smart thing to do. Absolutely. How to detach the electrodes of the, I'm guessing you're talking about the Evoke, okay? So how to detach the electrodes is a good question, and I kind of skipped it. So it shows we've seen it on the presentation, but since you have the PDF version and you won't be able to play the video, so I'm trying to get a good view here. I don't know what is a good view, but it's just a magnet, okay? So I pull it out, and it's a magnet here and a magnet there, and I put it back on, okay? So it's a lot more simple than you think. From the gear. How to detach the electrodes from the gear? Yeah, so that's what we've seen. Thank you very much. Thank you for the compliments. Wait. Okay, thank you all. So this was the rest of the questions. Thank you. I'm really happy to be here. And thank you for listening to me again. And if you have any further questions, write them down on the survey and we'll try to answer them. Bye.